Hi, everyone, and welcome to the World Doc Allen podcast. I'm excited to welcome to the World Doc Allen Lindeman. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. Today's topic, complications after surgery. What are the main complications after surgery?
Well, fever would be the first one, then infection, then bleeding, and then organ damage.
And what about long-term?
Well, those would include hot flashes, heart disease, and painful intercourse.
What is the most common short-term complication?
Fever is the most common one. You know, for years, for the last 100 years at least, we've used 98.6 as the normal or average temperature. It turns out that that's not right, and our temperature is probably more like 96 or 97. So when we have the directions given by the hospital to call for a fever that's over 100 or 101, 101 is the most common temperature used for that. They may actually have an elevated temperature of 4 or 5 degrees, which is higher than what you'd want it to be and very insensitive. I always recommend checking temperatures at 8 in the morning because that's the lowest, and 8 in the evening, that's the highest. If you have a fever of 100 degrees at 8 in the morning, that's high. And there are some people who run a fever only one time a day. So you have to be careful. If you feel that you have chills or you don't feel good, check your temperature when you feel cold.
What is the second most common short-term complication?
That would be infection. And, you know, depending on what kind of surgery you have, if you have a surgery through your abdominal wall, you can get an infection there. But if you have a vaginal surgery or a vaginal assisted or laparoscopic surgery, your infection will much more likely be only at the top of the vagina or beside the uterus, which has been removed.
What is the third most common short-term complication?
That would be bleeding, and you can have bleeding that's right away, and it's so much that the patient needs to be returned to the operating room in order to stop it. But there's also a smaller bleeding that would make a small hematoma, you know, probably an inch or two in diameter, and that can get infected and cause a fever. So and then that would probably, some of those would respond to antibiotics, IV, and some of them would need to be drained or otherwise removed.
What is the fourth most common short-term complication?
Well, that would be organ damage. For example, if you had, it's possible to tie off the tube that carries the urine from the kidney to the bladder. And if that's discovered right away at the time of surgery, it's really not much of a problem. Or if it's discovered in the next day or two, that's also not much of a problem. But if it goes long enough, you can lose a kidney. And of course, there's always the possibility of making a hole in the colon so that you'd wind up with a colostomy. And those would be the extreme effects of organ damage.
All right, best place to go is worlddocallen.com and safepregnancy.com, or go to Amazon and pick up Pregnancy Your Way today. Thanks again, Doc.
Thanks a lot, Neil.
All right, that was the World Doc Allen podcast. Take care.